Good afternoon, everyone. We're going to wait just a couple of minutes before we get started. We appreciate you taking some time to join us for our webinar today about our HIE platform updates and some other things here at Contexture. We'll get started in about 2 to 3 minutes. We're letting folks gather up in the Teams meeting. Good afternoon, everybody. We have folks still joining us, so we'll wait just a couple more minutes before we get started. Thanks for joining us. Good afternoon, everybody. Just another minute or so while people gather up, and then we'll get started. Thanks for joining us. All right, I think we're about ready to get started here. I'm not hearing a lot of dings as people are waiting in the lobby to join our meeting, so I think we'll get started. We got a couple more coming in. We'll just wait just a few more seconds and then we'll jump in. All right, well, again, thank you all for joining us today for our webinar, our Contexture webinar. This is for our Western Slope, our QHN participants, to give some HIE platform updates, talk a little bit about our Part 2 data, and then have some time for just question and answer sessions with participants. A couple of housekeeping items. If you have questions, please put those into the Q&A, to the Q&A section of the Teams meeting, and we will get those addressed. Sometimes that's a little bit buggy, so if you need to put them in the chat, you can certainly do that. It's easier if we put them in Q&A, and then we will work to address those questions. So the preference is the Q&A section. If we can't get to questions during today's meeting, or if there's something we need to take back, we will do that, and then we will follow up post-meeting on those questions and get you guys the answers. Again, we really appreciate you joining us, taking time out of your busy schedule on a beautiful Wednesday afternoon in Western Colorado. My name is Mark Lasso. I am the Chief Growth Officer here at Contexture. I'm joined by Jen Barrett. She is our VP of Business Development, as well as Sherry Corey. Sherry is a Director of Development and Engagement here at Contexture and at QHN. We also have a very supportive team joining us today. We have Micah Jones, who is our VP of Legal and Counsel here at Contexture. Brittany Detler is a VP of Solutions and Market Development. Janice Lawrence is a VP of our Project Management Office, and Peter Steinken is our Director of BizOps. We also have the wonderful marketing staff, Charity and Liana and others that are helping us make this happen today. So we have a real great team that's here putting on the webinar, as well as able to answer questions as those come up during the conversation today. So my job today is, as part of this agenda, is to move the slide forward if we can. There it goes. My job as part of the agenda is to give the introductions. Then I'm going to give a few quick contexture updates. Then I'll turn it over to Jen and to Sherry to dive into more details about our Part 2 data overview and contexture solutions, and then we'll leave time for Q&A at the end. So I want to just center us real quick on who Contexture is and a little bit about our mission. We support communities through information sharing. Our mission is to advance individual and community health and wellness through the delivery of actionable information and analysis. Contexture was formed by Coreo and Health Current coming together in 2021. And then Quality Health Network, QHN, we recently joined that about a year and a half ago now, a little bit over a year and a half ago. And that represents, Contexture now represents the largest health information exchange in Western Colorado. The Contexture business lines. This is a slide just giving a quick snapshot of a high level of the things that are our main business lines. First and foremost, inside of that is our HIE core services. HIE core services are really related to making sure participants have the information that they need to serve the people that they're caring for. And that's in our mission. And that's at the top of everything that we do as we're going about our work. Another major service line for us is our quality improvement activities. This includes the ability to pull and share data related to quality improvement, but then also we have teams that can help practices. We have quality improvement advisors that can help participants do better about quality improvement activities. We have a very robust data analytics solution line and business line. This includes much robust reporting, and we're greatly enhancing our data analytics capabilities with our migration to one platform, our new platform that we're transitioning to late this year, that we'll talk a little bit more about in some of our solutions coming up. But data analytics includes our reports and reporting and a bunch of different types of analytics that we can do related to population health, readmissions, wellness visits, you name it. We have a really robust data analytics and reporting section. Our social determinants of health in Western Colorado is a community resource network. Many of you are familiar with our activities there. That is tying together the social health information and our community-based organizations into making sure that the needs of that in relation to behavioral health and overall physical health are recognized and being addressed by the people that are working with folks in our communities. Another business line we have is advanced care directives. In Arizona, that is the AZHDR solution. In Western Colorado, we're currently planning for what that solution looks like into the future as we transition from the legacy QHN platform to the new one platform that we'll be talking about here in a little bit. We have a very robust public health solution and services too for our public health departments. This includes vast data distribution on behalf of public health across both states. We also do things like syndromic surveillance, newborn screening, e-referrals, and many other supportive activities with public health that further their value in participating robustly in health information exchange. Wanted to talk just a little bit about our new upcoming platform. Many of you know that we are moving off of and need to be off of our current legacy QHN results and QHN platform coming up here in the next several months. So we're moving to a new unified platform, which is called One Platform. This has great improvements in functionality and gets more data available in much more easy to get to ways, is how I would describe this. Much better system performance, the user experience is enhanced, and it's easier to find the information that you need, which ultimately will result in better care for the patients and the people that you're serving, and also higher satisfaction in the services. So we're bringing all of the data together into unified technology and systems. That system's called One Platform. My slides are lagging here just a bit, but I hope they're switching for you all on the screen. So the future is One Platform, as I mentioned. It's really a combination of all of the data But it's also about unifying the way that we do contracts and pricing and fees across all of the regions that we serve. So many of you are aware that we're also in the process of recontracting with our participants, and this is all part of scaling and unifying for better, more unified solutions and services into the future. So it's not just about the technology, but it's about all of the supporting activities that roll up into that. As you're bringing three organizations together, you can probably imagine that these activities are necessary to make this more unified and scalable and equitable for all that are involved in health information exchange across our regions. Here's a quick snapshot of the timeline. We're in the process now of contracting with participants, and we're anticipating a go live sometime later in the year in Q4. We will be announcing those exact dates as we get a little bit closer to those dates. In June, then, new contracts will become effective, or sorry, January of 2026, I should say, new contracts become effective at the same time as new pricing becomes effective as part of the one platform, migration to one platform. We'll have much more updates coming out related to that as we get closer to the end of the year, and those specific dates and times are set. I've got one more slide here I wanted to show before I turn it over to Jen to talk a little bit about, in more detail about a few things, including Part 2 data and HIE overall, and then on to Sherry. But really what I wanted to highlight is health information exchange, and what we do at Contexture is really about the physical, the behavioral, and the social health information, and making sure that that information is available for our participants and for our care providers so that they have the information that they need to serve the patients that they serve. That's our mission, that's our goal, and is at the top of mind for us day in and day out as we go about this work. We appreciate all of your partnership to that end. We have really robust partnership in Western Colorado and beyond, in the rest of Colorado and Arizona to that end. So bringing all three of those things together equals happy people, and that's really what we want to do. So with that, I will now turn it over to Jennifer Barrett. Jen, thanks for joining us today, and I'll let you take it away.
Yes, thanks so much, Mark. It's always great to take over when someone's dancing and doing fun stuff there. So I get to go over a few items related to HIE and Part 2 specifically. But this first slide that we're sharing right now is just a quick refresher on the HIE opt-out. So in Colorado and Arizona, we're opt-out states, and the patient's protected health information may be shared with other participants through the HIE unless the patient opts out. If the patients do opt out, then none of their protected health information, including that which is Part 2, is available through the HIE. It is a separate process from our Part 2 consent. So as Mark had mentioned, we've been doing these webinars across both Arizona and Colorado, and this was an item that came up with quite a few questions when we talked to Arizona. So we wanted to make sure to highlight that again, this particular slide is specific to HIE opt-out, and now we're going to talk a little bit more specific to Part 2 specifically. So one of the things that we wanted to do is spend a couple minutes with just reiterating Part 2 data and what it is. I won't read through all of these bullet by bullet, but these slides will be shared with everyone to make sure that it's a quick overview of what Part 2 data is and what is represented. Part 2 data in general is health information from federally supported substance use treatment programs. There's a couple of different examples listed here, such as a clinic that provides substance use disorder treatment, or a behavioral health center that offers both mental and SUD. This is regulated through federal law of 42 CFR, and it includes diagnosis, treatment, and referrals. So we are introducing a new Part 2 consent form that is going to be coming out into the community. It is now available, so you'll be seeing more information about this in the very near future. But we have created this new form to be able to capture the Part 2 rules and make sure that we're clear about that community information that's needed to be shared. So We specifically are introducing this to make sure that it allows for broader sharing with providers and health plans. It includes the redisclosure for the HIPAA rules and is available for use across organizations and not just a single recipient. The form has very clear directions on how to fill it out, and we want to always continue to reiterate that we need to have all details filled in and that we do not want to have folks altering the form. For non-Part 2 healthcare providers, you are able to work with the individual to complete and upload this consent as well, if you happen to have someone that's coming into your practice and is requesting it. So we are using this Part 2 form as a legal requirement for us to make sure that the information that we receive and share is done so in accordance with the rules that we are held accountable to. So it really is being used to help build the health information exchange and making sure that we protect the patients, providers, as well as Contexture. And we do not want to have other forms used because that would potentially allow for unauthorized disclosures, which we do everything in our powers to prevent. So the legacy Part 2 consent forms will not work on our new platform. So QHN previously had a different form that is not going to be eligible to be used for our new one platform. So when we roll forward with that new one platform, this new consent form that was just shared is going to be a requirement. The reasons that we don't allow that previous form is that it does not support cross-organizational sharing, and it did not have standardized fields that are required as part of our HIE automation. So it really is previously designed for older workflows that are not going to be in place on our new platform. So how it works is very simple. There's just 2 steps. The patient and the provider fill out the form, and then the provider gets that uploaded to Contexture's portal. So once it is uploaded, the Part 2 data becomes available to the care teams, and the form stays active until it expires or is revoked. So in this instance, one of the things that we wanted to make sure to reiterate is the criteria for consent-based access is that there needs to be an access consent, an active consent form for the patient that is available within the HIE system, meaning that it needs to be completed and uploaded into the portal. And then those individuals who have access to the portal also have to have a contextured approved role. So we do see those as 2 very specific and distinct activities. We have very robust processes in place to make sure that we safeguard Part 2 data in our HIE. Again, we've got a couple bullets here that I'm not going to read bullet by bullet, but basically we want to make sure that folks are aware that we do follow industry best practices for privacy, security, and trust, and that we have role-based access as well as privacy preserving search behavior. So if Part 2 facilities remain hidden unless that consent is on file, that is something that protects the individual from having their data inadvertently shared. We have comprehensive audit logging, which occurs, and we have all user actions, including the consent, upload, revocation, and emergency access logged in our system. And those disclosure logs include the details of who it was that accessed it, as well as the time and what specifically was accessed. And it is very much built for compliance, which allows us to make sure that both consent-based and emergency access pathways are clearly identified. So this slide we created to really differentiate the blue side of this slide really speaks to the data that Contexture receives. So we receive information from Part 2 data providers, and that when it occurs, gets tagged in our system to be able to make sure that we have the applicable notification and then have rules access put in place so that only specific individuals that have the consent are able to review and access that data, and the ability for that medical emergency to also allow for that data to be available. On the right-hand side, in the orange bubbles, it speaks very clearly to the fact that we have the organizations manage consent, and that that's part of setting up the users, that you are aware of what user access is based off of the role that is approved for them. So data coming into Contexture and the blue side, and in the orange side, it's the data that would be accessed by individuals who have approval to get into the portal. Again, we want to reiterate the importance of what we do for monitoring auditing. Again, making sure that we reiterate that this is something that we take very seriously and have a robust process in place to do. As mentioned, we do log those consent form actions, and we do log the disclosure of medical records, and that goes through specific evaluation and discussion with our compliance and legal teams. So I am going to hand it over to Sherry Corey, who's going to walk through some of our Contexture HIE solutions.
Thanks, Jen. Thanks everyone for joining us today. I really look forward to this presentation and seeing all of your faces today. So thanks for joining us. My part today is I'm going to go over the Contexture One Platform solutions. What you can see here is a list of those solutions. I am going to go through each one of these, so we're going to go ahead and go to the next slide. One of the things that I did want to share with this group is our identity management system. This is a new system that is being rolled out on the new platform. It's called Verado. It does offer a master patient index with multiple identifiers to improve our patient matching. So we're excited about this new technology for the platform. I'm not sure. We'll go to the next slide. So this is our data senders. Data senders, this is you. These are our participants. This is each one of you that is sharing data into the Health Information Exchange. So this could be data such as lab reports, radiology reports, transcription. This data that's coming into the HIE is really used for better patient care and really to just facilitate a bigger picture of the patient's health. This is very similar to what we've had in the QHN platform. And so we're excited for our data centers to continue to send their data to us. The Patient Care 360 portal, this is better known as QHN results previously. The portal is really that longitudinal health record of an individual. This will change a little bit from how it is displayed. It will look a little bit different, but it will have the same functionality. I believe some new things that are exciting on the new platform is that you will have access to both Colorado and Arizona data. We'll also have some CCD data information, similar to what we're talking to today, Part 2 data via a consent, and some emergency department encounter reports. One thing I do want to note about the portal is that one new functionality that is exciting is the ability to favorite your patients. I know that we had heard this many years from our participants in the Western Slope is, can I have the ability to just select favorites so that when I go into the portal, I have a very easy way to look up my patients. So that is coming. We are excited about that. There is also more ability for lab trending and timeline views. We will continue to have connections to eHealth Exchange, the single sign-on capability from our portal to our social determinants of health platform, which is Community Resource Network. One other thing is that in the previous platform, there were two options to get to the prescription drug monitoring program. One was a direct link to PCDH, and the other was using OpiSafe. We will primarily be using the OpiSafe single sign-on to get into that information. And then a couple things just to talk about that will be discontinued in the portal is the ability to manually upload documents, not necessarily the consent form for Part 2. That will be uploaded, but if you previously had uploaded any type of notes or reports or anything like that, that ability to do that is going away. The organizational view where you had the ability to just see your organization's data and then to upload advanced care planning documents. Another solution that we are continuing on the new platform is direct secure messaging. Direct secure messaging, you all are familiar with, that is secure encrypted email. And Contexture is also certified as a HISP utilizing this technology. This allows for really that secure patient information sharing or communication between providers in the HIE. Notifications. Notifications were previously known as alerts in the QHN system. So these will continue. Alerts they're based on a member file, so that will continue as well. Your notifications can continue to be sent on a real-time basis or on a set cadence. And this really does help improve patient care through case management. So those will continue to be available. A couple of things I would note on some new features through our notifications is that you will have the ability to receive mental health hospital notifications. And then we also have clinical notifications. So you may have previously received some reports from QHN that had cholesterol information or diabetes or hepatitis or even COVID, but now we have moved these into notification options. I'll go through some of the reporting options as well, but this is new for us that we can now receive notifications for these type of clinical data. Quick results. This is new to our QHN participants. This basically what this is an inbox that is available in the portal. And in that inbox, this is where we would deliver lab results, radiology reports, transcription. These are delivered real time into that inbox. So this is new and unique to the one platform. And then we talked a little bit about standard reports. I won't go through each one of these, but we still have the ability to enable reports for you. A couple of the reports that I would like to kind of point out is the demographic report, the contact report, and encounter report. These are new reports to us here on the Western Slope. I'm not going to get into a lot of detail. I want to utilize our time for some Q&A at the end. But if you have any questions, basically about any of the solutions, any types of reports you can receive, a breakdown of those notifications, your engagement manager will be happy to assist you. But this is a list of those standard reports, keeping in mind that we also can still do custom reports. So that is an option as well. We will continue to have results delivery. Again, this results delivery is provider-based routing. So basically, you would receive these results into your electronic health record based on your provider being on the message. These are real-time delivery of that information to allow for that care coordination. Couple things on results delivery, formerly known as provider routing or provider delivery in QHN. Again, just to keep in mind, results delivery is based on providers being on the message. One thing that is being discontinued for results delivery is radiology and lab orders matching. That is going away. So if you happen to have that, that functionality will be going away. I would also like to talk about the image exchange. Some of you are familiar with our image exchange, which allowed for transmission of PACS images from one PACS to another. It also allowed for some viewing image capabilities and downstream delivery into the EMR. We do still offer an image solution. The new platform will use a deep link-based solution for imaging. So again, if you'd like some more information on that, please reach out to your engagement manager. And then another new functionality to QHN is a smart summary. So you can see that there are a list of the different types of smart summaries. Again, I won't go through each one of them, but really what it is, it's a comprehensive view of the patient's record. It compiles all the information that is available in the Health Information Exchange. It does a 12 to 24 month look back period of data and delivers that information to you. There are, again, those different types of smart summaries. Your engagement manager would be happy to go through those with you. That is a new functionality to us here in QHN. There are some features and functions that are changing. There are some solutions that we are offering in lieu of, some functionality that may be going away on our new platform, but we do have a November hot topic set up, And we will be going through each one of those changes. What are some options in lieu of a specific solution or functionality that you had previously in QHN? So watch for that information. And so what are your next steps? Well, sign your contracts. So you have probably been talking to your engagement managers about these new contracts that are in your inbox or that you have already signed. Our teams have been out and about in the community, really working with our participants on those new contracts Mark mentioned in the beginning. So continue to work on signing those contracts. If you have any questions on those, again, reach out to your engagement manager. But also watch your inbox for updates in the Contexture Connector newsletter. I really encourage you to sign up for that newsletter. It does give you updates on what's happening with the migration, the platform, just great updates in general. So I encourage you to sign up for that. And then also there is a link to visit our events to register for webinars. So I do encourage you to do that as well. And as always, contact your engagement manager with questions. We do have a few informational sessions that are coming up that I would encourage you to join. Obviously, this webinar today, we appreciate your attendance here today. We also have our annual summit in Grand Junction on October 9th. I have a slide that I'll share some more information coming up on that one. And then on October 23rd, we have another webinar reviewing the same information with our Front Range participants. There is training that is coming soon. You will be notified of that for our Patient Care 360 portal training. And then we will have some more training coming up on that Part 2 process. How do I complete the consent form? How do I upload that to the HIE? So those are some informational sessions that are coming up. And as I spoke of, this is information about our summit. We are excited about the lineup. We have Kim Femsteffer, the HICPUF Executive Director, joining us. We have an inspirational speaker, Paul Long. We're excited to hear from him, and just some other great information and speakers coming up in our summit. So I hope to see you all there. And I'm going to hand it back over for questions.
Can't see any questions yet, but if you guys can use the Q&A at the top of your screen, that's where we'd like to field all the questions. If that's not working for you for some reason, please go ahead and pop it in the chat. Your mics are muted today because of large groups, so please add your questions in the Q&A. Got one question here. You mentioned ACP documents cannot be uploaded in the new system. How will ACP be provided in the new HIE?
I can take that one. So the way that was done in QHN results is it was through a form upload directly into QHN results. On one platform, we do not have that same capability. So we are looking at that as a future development item. So it will not be available after we migrate over to the new platform, but it is something that we're considering for future development. We need, in Colorado, there is CDPHE, the Colorado Department of Public Health and Environment, has a mandate to enable advanced care planning, and so we're going to be having some conversations with them on how we could align with what they need to do there, and thinking about that more broadly across the state is an important part of the effort and the work that needs to go on there. So the answer is, out of the chute, there won't be a capability to do that. But that is something that is on the future development potential roadmap, and how we do that more effectively and more broadly across the state with other partners like the Department of Public Health and others potentially in the state.
Thanks, Mark. Another one is reports that are manually uploaded now will not work anymore. Did I hear that correctly?
I'm not sure that I'm following that. Reports that are manually uploading now. Sherry, do you know what's being asked there, or I'm not quite sure what's being asked?
Yeah, it may be, and again, I would love to get some clarification on that, but it may be where I spoke to the ability to upload documents. So like a office report, an office note, some type of reports or notes that potentially had been manually uploaded in our system previously, that we would no longer have that ability. But I know, Sherry, that was from you, so if I explained that correctly, please let me know, but hopefully that's what you were questioning.
Okay, the next one is, will we need to engage our HL7 interface teams to adjust what data we send?
Maybe, I would say. So as
Yeah.
contracts are signed and we're getting folks into the migration queue, there are potential adjustments that may need to be made for that data inbound to Contexture, and your engagement manager can help get you in touch with the right people to look into that.
Okay, and will web links from Epic be available? Any detail on changes for that?
I think that by web links, I suspect what is being asked there by Dean is single sign-on. I'm not sure, but if that's single sign-on, the answer is yes. The new platform supports single sign-on access to the longitudinal health record to Patient Care 360. So that will still be available. If that's not the right web link, Dean, maybe add another question or clarify that a bit.
Cool, I'll watch for that. Sarah asks, I know you mentioned it would be discussed in a future webinar, but will there be a replacement for the radiology and laboratory order matching functionality?
That is another one like much like our advanced care planning that we have on the list for future potential development. That's one that many of our participants have had a value in. So it's not available out of the chute, but it's certainly something that Contexture is looking at as a potential future opportunity to re-engage and bring that solution back.
Okay, and is there a plan or timeline to recover or dispose of EHT image exchange equipment that sites may have?
Most of that equipment, as I understand it, has been transitioned to virtual machines. But yes, if there still is eHealth Technologies, EHT is eHealth Technologies equipment on site, that is something that that we will follow up with, and I'll make sure to follow up with the eHealth Technologies folks to make sure that equipment is handled appropriately. And that we message that we know where that equipment is. I think most of that has been turned over to virtual machines. So if you don't mind sending a note to me or to somebody directly about which site has that, I can make sure that we follow up on that. I will put my email in the chat.
Okay, and I think Sherry added some more context to her last question. She says we upload our exam reports into QHN due to not having an interface.
The manual upload, Sherry, Corey, correct me on this one if I am incorrect, but the manual upload functionality is not available in Patient Care 360. It needs to come in through an electronic interface. So we need to convert that type of a workflow to an electronic type of upload workflow. Do I have that right, Sherry?
Yes, that is correct. And I know Sherry was confirming the question that yes, in fact, the reports she was talking about is that they upload their exam reports. And yes, that functionality is going away. We would need to look at what an interface directly to the HIE would look like.
Okay, and Dean wanted to let you guys know that yes, SSO integration was what he was talking about. So we are good on that one. Let's poke over here and see if we have any in the chat. Mark's email is in the chat. I don't see any new questions, so guys go ahead and add them if you have any. We have plenty of time to answer whatever you have. Nothing new coming in, but if you guys want to give it a couple more minutes, please put your questions in the Q&A. Where can participants access the new Part 2 consent form?
Jen, you want to take that?
Sure, we're in the process, excuse me, of distributing that information. So in the next couple of weeks, we will be going through the process of communicating and sharing that information.
What about the hospital reports that are uploaded by them and not shared via an interface? There are some colonoscopies and cardio that are manually uploaded.
Sherry, you want to take that one?
Yeah, any type of a manual upload into the system will not be a functionality that will be available on the unified platform. If there are hospital reports or hospitals that are manually uploading those reports today, we will need to talk with those hospitals about transitioning those to electronically being delivered to the HIE.
Yeah, we'd like to have a discussion with you, Jessica, if it's possible to convert those to electronic, and that can save time on the workflow side of that too. And in office, I can imagine that takes quite a little bit of time. We do recognize though that that's not always possible in with many different systems and for many other reasons as well. But that's certainly something to explore.
For jail contract, how do I make sure we are renewing the contract? From Crystal.
Sherry, you got that one?
Sure. Yeah. Crystal, thanks for the question. The work that's being done right now for our jails is specific to the healthcare provider of services. So typically this is like WellPath, all those other organizations that actually you contract with for the clinical type services. I know that your jail specifically, we had 2 different contracts. I'll make sure the engagement manager is reaching out to you to have those conversations, but the contract itself lives with the health service provider that you contract with at the jail.
We still have about 15 minutes, so feel free to add your questions in.
If there's any ongoing questions for folks as we're working through the migration and heading into the later part of the year, just want to encourage you to reach out to your engagement managers on the Western Slope. That's Sherry Corey and Sherry Schmitz and Wade Montgomery, Angela Rodriguez, and Tina Hughes, in addition to Sherry. But Sherry's always available to help coordinate and get information to where it needs to go so we can get your questions answered.
A couple more came in. Just curious if you know who the engagement manager is for St. Mary's and who they might work with at St. Mary's. Contracts would not be handled by my team.
Yeah, I can take that one, Dean. The engagement manager that oversees St. Mary's is Wade Montgomery. Dean, if you want to reach out to me, I can put my information in and I can connect you to Wade via email.
And Jessica wants to know, how will Contexture filter out substance use info if no consent is signed?
Micah, that one that you can address? How will Contexture filter out substance use info if consent is not signed? I think was
Yeah,
the question.
sure.
Did I get that right?
Yeah, sure. Happy to help with that. So, Contexture's approach to substance use disorder data is a multi-step process. So, first things first, we have to identify the entities that are holding Part 2 information. Pursuant to our contracts with our participants, if they are a data sender that wants to send us Part 2 information, they have to tell us about it first. So they're not permitted to send us Part 2 information until they tell us about their Part 2 information and get our approval to do so. Once we understand that the entity wishes to send us Part 2 information, and we will move into the implementation phase, in which case we will tag the data from that entity. And there are two possible ways we could tag that data. So there are some Part 2 facilities that have multiple electronic health records. They may have a health record, an EHR for non-Part 2 data, and then they have a separate EHR for Part 2 data. In that case, we would tag all of the data that came from that Part 2 EHR as being sensitive substance use disorder data, and that data will not be available without a consent unless there is a bona fide medical emergency, in which case then it could be accessed by the treating provider. In the scenarios where the data sender does not have a separate electronic health record for their Part 2 data, and their Part 2 data is commingled with their non-Part 2 data, then we would treat all of the data from that entity as covered by Part 2, because it's possible that there would be Part 2 data that would be flowing through that interface. So we do have to tag all of the data from that interface as being Part 2. So there are going to be situations where there are mixed use facilities whereby in order to access that information, we would need a Part 2 consent form on file, even if it was a patient that's not seen by that Part 2 unit. And so that is how we have to keep it tagged and separated. It's sort of like an all or nothing proposition unless the data sender can filter out that data and give it to us separately.
I have one that came through the chat. Will CIIS be a part of the HIE? Does anyone know what that acronym stands for?
Yeah, that is the Colorado Immunization Information System. And we do not get direct feeds from CIIS. This is something we continue to work on. There is some immunizations information available just in the longitudinal record generally. We also handle some immunizations information that we send to CIIS on behalf of participants. But I think where I suspect the spirit of the question is probably, will we get a copy of the CIIS information that's in the CIIS system generally via the HIE? And today that's not an option, but it is something that we continue to explore with them.
I think we're caught up on questions, so we can wait for a few more. Okay, got one more in. I am still confused on the image exchange, where the PowerPoint indicates a new platform uses a deep link-based solution for images, yet PACS Health is eHealth is discontinued. What is the difference between the two?
I can talk. Janice, did you hear that question? Janice might be able to describe
Yeah.
how the new image exchange system works. It's not the same thing, but there are capabilities for folks to use deep links to get to images. I'll let Janice explain that. She can do it much more eloquently than I can.
Yeah, happy to. So we have a specification. We're happy to share that specification out. That's going to require your PACS vendor to meet that specification. So where with eHealth Technology, they were the vendor, the third-party vendor, contracted by QHN to be able to meet the requirements necessary to create those deep links within the portal. Because we will not be carrying forward that contract with eHealth Technology, it'll be the responsibility of your PACS vendor, your radiology vendor, to be able to meet the specifications of our HIE vendor, Health Catalyst. And so what that means is they will send a link as part of your HL7 message inbound to Contexture, and then our HIE vendor Health Catalyst will make a viewer available. So when a portal user clicks on that link in the portal, that viewer will come up as a separate window and visualize the image that's relative to that specific radiology report. And so there are requirements around how that link needs to be formatted and structured in order to ensure not only the user gets access into the PACS system to see that image, but that the user is only seeing the image relative to that report. And that's what that specification details.
Thanks, Denise. Well, I know there could be some more questions that come up after the webinar today, and we'll have more information to come. Please feel free to reach out again to your engagement team, to Sherry. Sherry's email address is in the chat. If we can be of any assistance and help answer additional questions. I know we're close on time. Maybe we give folks a little bit of time back if there aren't any other questions.
Not seeing any.
Not seeing any. So again, everyone, thank you so much for joining us. Again, feel free to reach out. We're happy that you spent some time with us today. We're looking forward to migrating and moving you over to the new system. We think there's some really, really cool things to see and to do on the new system that will greatly enhance workflows. We do recognize too that change is hard, and these changes take time to work through and to align with. So we also want to recognize and be responsive to that. But we're going to get to the other side and be in a better place with our new systems and with great partners like you. So again, thank you all for joining us. We appreciate your support, and we'll look forward to talking to you all soon.
Thanks,
Thanks,
everyone.